بسم الله الرحمن الرحيم.
Peace be with you. This is Asmar Batul from British Institute YouTube channel. This channel is based on knowledge. You are kindly requested to like, share and subscribe our YouTube channel. Thank you.
Dear viewers, hope you are safe and sound. Today we are going to discuss about the topic infertility,
which means when someone is unable to have a baby.
Realities you should know about infertility. Infertility means not having the option to get pregnant within certain parameters. Infertility is a typical issue of about 6% of ladies matured 15 to 44. Infertility can be because of the lady, the man, both genders, or unknown issues. Infertility in men can be because of varicocele, injury, low or missing sperm check, sperm harm, liquor use, or certain sicknesses like diabetes, cystic fibrosis, immune system illnesses, diseases, hormonal problems, and hereditary issues. Risk factors for men's infertility include alcohol and drug use, toxins, smoking, age, medical issues like obesity, drugs like testosterone, radiation, unnecessary testicular heat, and chemotherapy. Risk factors for ladies' fruitlessness incorporate ovulation issues like polycystic ovary condition, blocked fallopian tubes, uterine problems, uterine fibroids, age, stress, poor diet, athletic training, and those risk factors listed for men. Aging is a significant danger factor that diminishes a lady's fruitfulness. After age 35, about 33% of couples have ripeness issues. More established ladies' eggs are decreased in number, not as solid, and more averse to be delivered by the ovary. The lady is likewise bound to have a miscarriage and other health problems. Ladies under age 35 should go after a year, and ladies more seasoned than 35 should pursue a half year to get pregnant prior to reaching the primary care physicians on the off chance that they have no medical issues. Specialists utilize the accounts of the two accomplices and may run tests, for example, sperm considers, ovulation tests, ultrasound, hysterosalpingography, or laparoscopy. Infertility might be treated with medication, medical procedure, manual semen injection, or helped regenerative innovation, in view of the couple's test outcomes and different components. Numerous prescriptions might be utilized to treat infertility in ladies. Intrauterine insemination is managed impregnation in which a lady is infused with sperm into the uterus. In helped regenerative innovation (ART), a lady's eggs are eliminated and blended in with sperm to make undeveloped organisms that are set back in the lady's body. Contingent upon the lady's age, ART has about a 3% to 31% achievement rate. There are a few kinds of ART: in vitro preparation, zygote move, gamete move, and intracytoplasmic sperm infusion. A few couples get a child with benefactor eggs when the lady's male accomplice's sperm is utilized to treat another lady's egg, and that other lady conveys the embryo to term, and the baby is embraced. A gestational transporter is a lady who has an incipient organism set in her uterus, conveys the hatchling to term and gives the child to the couple, or mindful people, that created the incipient organism.
What is infertility? All in all, Infertility is characterized as not having the option to get pregnant. Imagine, following 1 year, or more, of unprotected sex. Since ripeness in ladies is known to decrease consistently with age, a few suppliers assess and treat ladies matured 35 years or more seasoned following a half year of unprotected sex. Ladies with infertility ought to think about making a meeting with a conceptive endocrinologist, a specialist who represents considerable authority in overseeing infertility. Regenerative endocrinologists may likewise have the option to assist ladies with repetitive pregnancy misfortune, characterized as having at least 2 unconstrained unsuccessful labors. Pregnancy is the consequence of a cycle that has numerous means. To get pregnant, a lady's body should deliver an egg from one of her ovaries. A man's sperm should get together with the egg en route. Treat. The treated egg should go through a fallopian tube toward the uterus, belly. The undeveloped organism should connect to within the uterus, implantation. Infertility may result from an issue with any or a few of these means. Impaired fecundity is a condition identified with infertility and alludes to ladies who experience issues getting pregnant or conveying a pregnancy to term.
Is infertility simply a lady's concern? No, infertility isn't generally a lady's concern. Both men and women can contribute to infertility. Numerous couples battle with infertility and look for help to get pregnant, yet it is normal considered as just a lady's condition. In any case, in about 35% of couples with barrenness, a male factor is distinguished alongside a female factor. In about 8% of couples with infertility, a male factor is the solitary recognizable reason. Practically 22% of men matured 25 to 44 years in Pakistan that they or their accomplice saw a specialist for guidance, testing, or treatment for infertility during their lifetime.
What causes barrenness in men? Infertility in men can be brought about by various factors and is commonly assessed by a semen examination. At the point when a semen investigation is played out, the quantity of sperm, fixation, motility, development, and morphology, shape, are surveyed by a trained professional. A somewhat unusual semen investigation doesn't imply that a man is essentially barren. All things considered, a semen investigation decides whether and how male components are adding to infertility. Disturbance of testicular or ejaculatory work. Varicoceles, a condition wherein the veins on a man's gonads are enormous and cause them to overheat. The warmth may influence the number or state of the sperm. Injury to the testicles may influence sperm creation and result in lower number of sperm. Unfortunate propensities, for example, weighty liquor use, smoking, anabolic steroid use, and illegal medication use. Use of certain medications and supplements. Cancer treatment including the utilization of specific sorts of chemotherapy, radiation, surgery to remove one or both testicles. Ailments like diabetes, cystic fibrosis, particular kinds of immune system issues, and specific sorts of diseases may cause testicular disappointment. Hormonal issues. Improper function of the nerve center or pituitary organs. The nerve center and pituitary organs in the mind produce chemicals that keep up with typical testicular capacity. Creation of an excessive amount of prolactin, a chemical made by the pituitary organ, frequently because of the presence of a favorable pituitary organ tumor, or different conditions that harm or weaken the capacity of the nerve center or the pituitary organ may bring about low or no sperm creation. These conditions may incorporate kind and threatening, harmful pituitary tumors, inborn adrenal hyperplasia, openness to an excessive amount of estrogen, openness to a lot of testosterone, Cushing's disorder, and persistent utilization of meds called glucocorticoids. Genetic disorders, genetic conditions like a Klinefelter's disorder, Y chromosome microdeletion, myotonic dystrophy, and other, more uncommon genetic problems may make no sperm be delivered, or low quantities of sperm to be created.
What causes infertility in ladies? Ladies need working ovaries, fallopian tubes, and an uterus to get pregnant. Conditions influencing any of these organs can add to female infertility. A portion of these conditions are recorded beneath and can be assessed utilizing various tests. Interruption of ovarian capacity, presence or non-attendance of ovulation, anovulation, and impacts of ovarian age. Overall, 28 days in length. Day 1 is characterized as the primary day of full stream. Regular unsurprising periods that happen each 24 to 32 days probably reflect ovulation. A lady with irregular periods is likely not ovulating. Ovulation can be anticipated by utilizing an ovulation indicator pack and can be affirmed by a blood test to check the lady's progesterone level on day 21 of her period. Albeit a few tests exist to assess a lady's ovarian capacity, no single test is an ideal indicator of richness. The most normally utilized markers of ovarian capacity incorporate follicle animating chemical FSH, esteem on day 3 to 5 of the period, hostile to Mullerian chemical worth AMH, and antral follicle check AFC, utilizing a transvaginal ultrasound. Disturbances in ovarian capacity might be brought about by a few conditions and warrants an assessment by a specialist. At the point when a lady doesn't ovulate during a feminine cycle, it's called anovulation. Expected reasons for anovulation incorporate the accompanying polycystic ovary condition, PCOS. PCOS is a condition that makes ladies not ovulate, or to ovulate sporadically. A few ladies with PCOS have raised degrees of testosterone, which can cause skin breakout and abundance hair development. PCOS is the most widely recognized reason for female infertility. Decreased ovarian saved or ladies are brought into the world with the entirety of the eggs that they will at any point have, and a lady's egg check diminishes over the long haul. Reduced ovarian hold is a condition where there are less eggs staying in the ovaries than typical. The quantity of eggs a lady has decays normally as a lady ages. It might likewise happen due to intrinsic, clinical, careful, or unexplained causes. Ladies with decreased ovarian save might have the option to imagine normally, yet will create less eggs because of richness medicines. Utilitarian hypothalamic amenorrhea, FHA. FHA is a condition brought about by unnecessary exercise, stress, or low body weight. It is here and there related with dietary problems like anorexia, improper function of the hypothalamus and pituitary organs. The nerve center and pituitary organs in the mind produce chemicals that keep up with typical ovarian capacity. Creation of a lot of the chemical prolactin by the pituitary organ regularly as the aftereffect of a considerate pituitary organ tumor, or inappropriate capacity of the nerve center or pituitary organ, may cause a lady not to ovulate. Premature ovarian inadequacy, POI, now and again alluded to as premature menopause, happens when a lady's ovaries fall flat before she is 40 years old. Albeit certain openings, like chemotherapy or pelvic radiation treatment, and certain ailments may cause POI, the reason is frequently unexplained. About 5% to 10% of ladies with POI consider normally and have an ordinary pregnancy. Menopause. Menopause is an age-fitting decrease in ovarian capacity that normally happens around age 50. By definition, a lady in menopause has not had a period for somewhere around 1 year. She may encounter hot glimmers, temperament changes, trouble in sleeping, and other symptoms as well. Fallopian tube deterrent. Regardless of whether fallopian tubes are open, obstructed, or swollen, hazard factors for obstructed fallopian tubes, tubal impediment, can incorporate a background marked by pelvic contamination, history of burst and infected appendix, history of gonorrhea or chlamydia, known endometriosis, or a past filled with stomach or medical procedure. Fallopian cylinders might be assessed by hysterosalpingogram (HSG) or by chromoperturbation (CP). Hysterosalpingogram (HSG) is a X-beam of the uterus and fallopian tubes. A radiologist infuses color into the uterus through the cervix and all the while takes X-beam pictures to check whether the color moves uninhibitedly through fallopian tubes. This assesses tubal type, width, and patency. Chromoperturbation is like a HSG yet is done in the working room at the hour of the laparoscopy. Blue-hued color is gone through the cervix into the uterus and spillage and tubal type, shape, is assessed. Abnormal uterine contour, physical characteristics of the uterus, contingent upon a lady's side effects. The uterus external symbol might be assessed by transvaginal ultrasound to search for fibroids external symbol or other anatomic irregularities. On the off chance that doubt exists that the fibroids might be entering the endometrial cavity, a sonohystogram (SHG) or hysteroscopy (HSC) might be performed to additionally assess the uterine climate.
How do specialists treat infertility? Infertility can be treated with medication, surgery, intrauterine insemination, or assisted reproductive technology. Frequently, prescription and intrauterine insemination are utilized simultaneously. Specialists suggest explicit medicines for barrenness based on the components adding to the fruitlessness, the span of the barrenness, the age of the female, the couple's treatment inclination in the wake of directing about progress rates, dangers, and advantages of every treatment choice.
Hope you learned something from this video. If so, then share this video with your friends. Also like this video. Don't forget to subscribe this channel. Thanks. Take care of yourself. See you in the next video. Goodbye.